Historically, of course, it was experts who came in and designed a building which they saw would be the correct building. Well, this is very different from that.
Not everyone understands drawings or can work out what the scale of a space might feel like from a drawing, but you can walk into a prototype and you can see what it's like and how that feels.
The opportunity to partner with lived experience consumers and personnel, people with real experience in day-to-day life using these facilities, is very important.
One of the recommendations that we're working on at Mental Health Reform Victoria is the expansion of acute beds. As a person with lived experience, I'm providing my own input into that and supporting others to do that as well. I've worked it out. I've spent 172 nights in 30 years in these type of rooms. So that's like half a year in 30 years.
There'll be so many things that people don't think about if they don't have a lived experience. I've been a carer for a long time. My mother has accessed a lot of mental health services, so I've seen a lot of bedrooms in hospitals, and they usually feel very cold and stark and not very welcoming.
I think it's more about acknowledging the person when they come into a mental health facility. It really comes down to the basics and having access to their own bathroom, to their own privacy. It's bringing it back down to the individual and doing everything we can to make them feel as comfortable as possible for their recovery.
It moves us away from a cold, clinical, hospital-type setting to a more homely environment.
It's softer and there's more warmth to it. I'm definitely not a colour specialist, but colour does impact.
There's an earthiness which makes you feel at home.
When somebody becomes unwell and they have to go into a unit, what you want for them is a therapeutic space, not a space that actually causes more harm.
They don't get a sense of enclosure. They immediately see windows and they've got a view to look out to.
Just feeling better about being in that space will help people to recover more quickly.
We're talking about artwork, about windows. We're talking about natural light, storage for people's belongings, being able to turn on and off lights in a normal way and have fittings in there which we might have in a home.
Handing over of control gives them a sense that actually their rights are being protected. It's affording dignity. As clinicians, of course, we also have a part to play in our expertise in working with these facilities over a long period of time is very valuable.
To get a good balance between what's comfortable for consumers and what's safe for consumers.
It's so pleasing to see this process and be involved in this process rather than to think we're just going to plonk a standard hospital building in a place, and it's amazing progress.
It creates spaces, creates an environment where the staff can support the consumers in their recovery journey. And I think that's what this is actually all about. And I think both for staff and for patients, it's a great step forward.